guys, Dr. Kendi here, and welcome back to my Oral Health Diaries. Before I proceed with today's episode, I would like to thank my 100 subscribers. We're at 100 subscribers now. I'm so excited. We're finally, getting in there and learning about oral health, and I really appreciate your receptiveness and everyone who's been sharing and liking my videos. I am very, very grateful, and let's continue learning together. So welcome to today's episode, episode 4. We are going to be discussing oral hygiene aids, focusing on interdental cleaning. When we did our episode on toothbrushing, we said that we are going to discuss other ways of cleaning other areas in your oral cavity that the toothbrush may not be able to handle. This is the episode. So I'm going to start with interdental cleaning, which just means cleaning between your teeth. So when you're brushing, the brush will just go mostly over the smooth surfaces or the facial surfaces, what you can see. But between the teeth, then the toothbrush is not able to clean between there. So how are we supposed to clean between these areas? These areas actually account for about 40% of the tooth surfaces. So we need to learn how to get in there and get the plaque out so that we may achieve almost 100%. There's never really like 100%, but you try to get as close to 100% as possible. So the fast and very common method of interdental cleaning is dental flossing. So dental floss is just a string that we use to clean between the teeth. You may get a long floss that comes in a pack similar to this, and I'll show you how to use it. And then you may also choose to get a pick floss. It comes attached to this pick like that at the edge here. This is steel floss, and both of them work the same way. Now, when you choose to buy this long floss, how you use it is that you open it, of course, then you'll find your string inside there and you pull it. How I prefer to use it is I take it around my arm just to measure the length like that, and then I cut it, okay, and you can put that away, okay, and then you wrap one side. If you're right-handed, you can wrap around your right middle finger, like majority of it, you wrap it, if you're right-handed, like that, and then like a short piece on your left side. Then you're going to be using your index finger to push the floss between your teeth so that you're able to clean. When you're doing this, it's important to note that you should not use so much pressure. Normally, the teeth are not attached all the way, like your teeth are not hazijashikana. There's just one place that we call a contact area that may be a bit difficult for the floss to pass, but it will go right through if you just pull and like back and forth movement gently, not to just kind of push the floss down because it's going to hurt your gum. So you're going to be taking it between your teeth, like so, using your index fingers, you push it down as you pull back and forth. Okay. Once it has gone through that contact point, you'll actually feel, and then you need to adapt it onto the tooth. You actually need to push and adapt. So you're going to see how I'm going to do it. Like that. So once you adapt it around the tooth, you just clean the tooth and then you slide it back up. What we need to appreciate is that the gum is not completely attached onto the tooth all the way. There's a part of your gum that we call the free gingiva. So this is the free gum. So there's like a space, a small space between the gum and the tooth. That's where sometimes that goes and hides. We call it like subgingival plaque. Imejificha huko chini. It's easier to clean over this area that you can see, but we also need to learn how to clean that area, that subgingival area where food may be packing. So floss is one way. I've shown you one way of wrapping the floss around your finger. You may also choose to tie at the ends so that you have just like a circle like this. I've tied one here. So you have something like this round, so you don't have to tie it around your finger if you don't wish to. So you can choose to start from one end using your fingers, then you can Same thing. This is just a different way of doing it. So that's our long floss that you can get. This one comes in really nicely because you can take it anywhere with you. You can put it in your handbag, put it in your traveling bag. There are other really nice, cute ones that you can even use as key holders. Very nice floss, okay? For those who prefer the pick flosses, I have one here, this, okay? It just comes attached to the end of the pick, but it's just steel floss, same thing. Contact area, slide down, pole too. Don't be so rough because you're going to hurt that gum between your teeth. The gum between your teeth is like a peak. We call it the interdental papilla. It's like a nice peak, like a mountain peak. So you don't want to destroy it. If you're so aggressive, you'll keep damaging it. So you just need to do it slowly. Slide down the contact area, adapt the floss around the tooth, clean as you're coming up, and then just, you know, remove the floss. So this you use once and then you throw it away. You will use it between all the areas. That's why I prefer this long floss, because then you're able to use a different piece at every point. So that's about floss. There's also a difference between waxed floss and unwaxed floss. The details are a bit intricate and complex. I don't want to go into it, but your oral health care provider may recommend that you use waxed or unwaxed depending on the need, because they work a bit differently. Okay, so that's it about floss. The next means of interdental cleaning would be something we call an interdental toothbrush. Now, we focused on toothbrushing last time where we were using our macro toothbrushes to brush the surfaces of our teeth that we can see, but there are other nice tiny toothbrushes that we call interdental brushes. So this is how they look, like that. They look like little bottle brushes, but now they go between your teeth. So it's just like a metallic rod. Some of them are even plastic, and then they have these bristles on the side. So they just go between your teeth, the area down there. It's called the gingival embrasure. What we normally do, we measure. These things come in different sizes, so that's why you see they have different colors. When you go to the supermarket and you're looking at the shelves and you're like, do I want orange? Do I want green? Do I want... These colors are actually for sizes, so it would be best that you seek consultation from your oral health care provider. They'll be able to measure and decide if you actually need to use an interdental toothbrush. For me, I recommend these toothbrushes a lot for patients who have suffered periodontitis or gum disease, so then their gum level has gone a bit low. So these toothbrushes now are able to get in there between the teeth without damaging the gum, and they help clean a lot. As opposed to flossing, these are more effective, especially for patients with periodontal disease. So you may want to learn more about these interdental toothbrushes. I know most people don't purchase them, but they're really, really good, very important. Okay. Now, we're on to the third one. We have things we call oral irrigators or water flosses. Now, we've used the string floss that we've all seen, but now there's like the superior one that is called an oral irrigator or a water floss. I have an example here that I'm just going to show. I will not remove it from the package, but if there's someone, you know, who is interested in learning more about it or purchasing one, you can always contact us and we will assist you. So this is the machine, the oral irrigator. This bottom part here is the part that carries the irrigant. If it's water, if it's mouthwash, this is where it goes. So this is basically the, like for the electric toothbrush, it's the foundation of the water floss. It'll come with a charger where you'll be charging it. It's electric. And then it comes with a range of picks that you can use. So they just look like this. Okay, and they have been, you know, color-coded so that you know which pick to use and how to use it. We also have a tongue cleaner that's attached there. So when you're cleaning your tongue, you can attach it and then the water will be coming out and then you can still clean your tongue at the same time. I won't go into the details of explaining how it works, but as I said, if you need more details, you feel free to contact us. The greatest benefit of using an oral irrigator is that as opposed to these other interdental cleaning methods, this will actually contact the plaque and then it will flush the plaque out, because the water will continuously be coming into the mouth through either the tongue cleaner or the pick that you have chosen. So this is actually the best, and it's really kind of cool because it comes in a nice pack, very travel friendly, so you can always carry it along with you once you're done with your cleaning. Yeah, it's a cool thing to have. You could actually choose to gift someone this Christmas and they'll be so happy. All right, that's that. Before I go into mouthwashes, I believe I haven't spoken about wooden interdental cleaning aids. These are toothpicks or wood sticks. There's a big difference between a toothpick and a wood stick. A toothpick is what we use commonly to remove that food that is stuck between our teeth, and it's okay, but it's rounded, so it's not very friendly to the gum. So yes, you can use it, but it's not, it tends to be a bit traumatic. If you really need to, you can get a wooden stick. So it's kind of triangular, so it fits into that space properly, as opposed to the circular toothpicks that we mostly have in the market. Lastly, I'm going to discuss about mouthwashes or oral rinses. There are a variety of oral rinses available in the market. What we need to appreciate is that all of these oral rinses or mouthwashes have different components. We need to learn how to pick a mouthwash based on our treatment need. There are mouthwashes available that we say are cosmetic. This just means that they are not offering any kind of therapy to you. They are just helping keep your breath fresh, and it's okay. You can buy them and use them. They also come as sometimes like as a small spray. This one of mine it's not a spray, it's just a mouthwash. I just wanted to show an example, but you can get a little spray that can just help to keep your breath like kind of minty fresh if you have like a special occasion to be at. Then there are mouthwashes that contain fluoride. These are mouthwashes that we prescribe to patients who have increased susceptibility to decay. So we recommend that they use these mouthwashes so that we increase the deposition of fluoride to prevent progression of the decay. There are also mouthwashes that we say are antiseptic. The cheapest and most available one being warm salty water. That's what we always prescribe for our patients after an extraction, because the salt kind of helps to keep the extraction area clean. The salt is an antiseptic agent. There are other mouthwashes that are natural. So we have mouthwashes that contain aloe vera or sage or eucalyptus, all these things that just help to, they offer the same property of the natural ingredient in the mouthwash. The biggest now component is now the therapeutic mouthwashes. When we say therapeutic, that just means that your oral health care provider has recommended that you use that type of mouthwash. For now, the recommended mouthwashes that we have been giving a lot to our patients mostly are like chlorhexidine based, just for plaque control, because chlorhexidine has been proven to help with plaque control. It kind of helps with we said that plaque is like a meshwork of bacteria and dirt. So this chlorhexidine kind of helps to break it down a bit so that you're able to remove it easily. There are also mouthwashes that contain iodine. This may be prescribed for patients, who have some type of infection, so we want to help combat the infection. There are also hydrogen peroxide containing mouthwashes. Mostly these are for patients where we are doing, like whitening procedures. There's a lot of information about all these components of mouthwashes. What we need you to appreciate here is that you need to pick a mouthwash that works best for you and your treatment need at that time. So much to talk about with like interdental cleaning and mouth and other cleansing aids. We just want us to know that in addition to toothbrushing, because toothbrushing covers only 60%, this other 40% you need to try and add or substitute something. Ni kama sosa. You substitute something so that you make sure you're almost reaching 100% efficiency. I really hope you've learned something from this episode. feel free to ask questions. We will always make sure that we, respond to your questions. Maybe I would like to address a question that someone asked me from our previous episode about the chewing sticks. The chewing sticks, I think I was just mentioning in passing, but our nice director made sure that it came across. But the actual term for it is mswaki. You can actually get it from maybe a supermarket or a pharmacy that is stocked, or you can get it from a herbal market. Mswaki it comes from a tree called the arak tree. The arak tree is actually proven to be beneficial in terms of caries prevention and periodontitis prevention. So what happens is that you chew on the stick so that the stick kind of frays. Yani it becomes like a brush. So you fray the tree or the stick, and then you use the stick now to clean your teeth. It takes time, but it has worked. As we said, technique is most important. One time when we get a chance to go and have a look at people who've been using mswaki for years and years and they have maintained proper hygiene, then we will make sure we do a feature on that. But yes, mswaki is very efficient. If you can use it properly, it's definitely recommended. Thank you again for watching this episode. Let's continue learning together. Subscribe, like, share, and I'll see you again on the next episode of My Oral Health Diaries. We're already in the Christmas spirit, so I would like to wish all my viewers Merry Christmas as we approach this Christmas season. A lot of festivities, a lot of excitement. It's been a rough year for some of us, but we are finally getting to the end of it. I'm really looking forward to, this next year, but have an awesome Christmas and festive season. Deck the halls with boughs of holly, fa la 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 la. 'Tis the season to be jolly, fa la 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 la. Don me now our gay apparel, fa la 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 la. Deck the halls with what? What did they say? Okay, and I like burgers.